Hello, Don Pelto here. Welcome to the Podiatry Management Minute. Thank you for listening or watching. I'm going to share, these are kind of some simple little ideas, but this is one, I don't know if you use it. So I have patients, they come in the door and they come in, I'm treating them. And I've gone through a couple of renditions. I'm going to talk about another one tomorrow. That's a little more advanced way of doing this. But for many patients, when I need to get my staff, I have a hard time getting a hold of them. I know people use like a headset system. They use something real complex. What we have been using for years is what I call the door cracking system. So I crack the door a little bit. They might think it's hot inside there or something. I crack the door, and then that's a signal to my staff that I need help. It also can be a signal to my staff. Like it's an SOS, like rescue me out of this room because this patient won't stop talking. I know we all have those patients, but this is what I use. It's called the door crack system. Now, we don't currently use this system anymore. And I'm going to explain for the next one why we don't use it. And then in the number 16 is because we moved our X-ray, and where we do the X-rays now is around the corner, so they can't see if the door is cracked anymore. Like where their workstations are is not obvious. So we don't use the door cracking system. So just aside on this, if the patients didn't used to see if the staff didn't see the door cracked, what I used to do is I used to open the door and slam it, open it and slam it until they heard it, and then they knew I needed some help. But that is my idea. If you have any great ideas besides cracking the door, let me know what they are. And I'm going to tell you kind of version 2 of the door cracking and how it works next time. If you have your own tip, scan the QR code or click the link underneath this video and share your own tip. I'll send you a little free gift.